Hello, my name is Professor Melissa Owen, and I will be your course instructor for Community Health Nursing. Our first lecture focuses on community as the client. We will discuss healthcare trends in the U.S. and talk about public health nursing and the challenges these nurses face, as well as Healthy People 2020 goals. We will learn how to define our community and ways to collect data for your group community assessment project. Often the terms community health nurse and public health nurse are used interchangeably. However, they have specific meanings. Community health nursing. This is the use of a systematic process to deliver care to individuals, families, and community groups with a focus on promoting, preserving, protecting, and maintaining health. In public health nursing, this is a population-based practice defined as a synthesis of nursing and public health within the context of preventing disease and disability and promoting and protecting the health of the entire community. U.S. health trends. There are three major changes in healthcare for the 21st century. These are patient client-centered care, technology, and personal responsibility for health. Let's discuss patient client-centered care. What is client-centered care? It is care that focuses on the client as a whole. Client-centered care empowers the patient to take an active role in their own health care by encouraging them to participate in the decisions made. It includes the patient's personal preferences, values, family, and cultural traditions. Care is customized and reflects patient needs, values, and choices. Families and friends of the patient are considered an essential part of the care team. This approach may reduce health disparities among ethnic, racial, and sociocultural groups by promoting healthcare through a collaboration between the public healthcare nurse, a physician, and the healthcare facility. The second trend is technology. Through the use of health information technology, or HIT, providers, consumers, government, and insurers can all manage health information as well as monitor or track health statistics to obtain goals. Some examples are MyChart and electronic health records. This form of technology is a comprehensive means of managing and exchanging information. Here, providers can manage their patients' care through secure sites and share health information. The National Coordinator of Health Information Technology, or ONC, monitors the safety and security of health information technology and promotes the exchange of healthcare information to improve care. There are some major benefits to the use of health information technology. Those are improved coordination of care, support for evidence-based practice care, elimination of paperwork, reduced error, expanded access to affordable care, decreased healthcare costs, and improved overall health outcomes. Pictured here are examples of health information technology and how it is used or can benefit the client. Up in the top right-hand corner, you can see MyChart. Here you can view your lab work or current tests or diagnostics that have been run. You can schedule an appointment. In the bottom, another tracking device for lab values. So these are all very useful examples of health information technology and how they can benefit the patient and healthcare provider. Continuing our discussion on technology, telehealth is the use of electronic health information and telecommunication systems to support long-distance clinical health care, health-related information, and public health. Simply stated, it is the use of technology to deliver health care. Changes in the community and in the delivery of health care are contributing to the emergence of telehealth. Can you guess what those changes are? For one, our population is aging, leading to an increase in chronic health disease. Providers are seeing the need to reach out to underserved populations in rural areas or areas where there is a shortage of healthcare facilities and healthcare personnel. Preventative care through telehealth may decrease the need for hospitalization, thus reducing healthcare costs. Lastly, telehealth increases access to healthcare. The third trend in U.S. healthcare is the notion of a personal responsibility for health. This is the belief that if a person has a vested interest in health, they will do more to maintain it. As healthcare providers, we need to encourage active participation. For example, the use of health information technology, as discussed in the previous slides. When the client actively participates, they make a commitment to a lifestyle change such as diet, exercise, medication knowledge, and showing up for appointments on time. When the patient takes responsibility for their own health, this may increase utilization of healthcare services, diminish ER visits, and decrease overall healthcare costs. I have an example of a patient who does not take responsibility for their own health. As it goes, a patient shows up for an outpatient procedure. They were told in verbal and written instructions that they need to remain NPO after midnight and take medications as prescribed, including their blood pressure medications. The patient arrives and states that they ate a full breakfast because they were hungry and has not taken their blood pressure medication for 3 days. This is a true story. Now they have a blood pressure of 200/90 and they need to be rescheduled because they ate. If the patient had taken a personal responsibility for their health, then the procedure could go on. Now, the hospital is faced with a decreased utilization in healthcare services, decreasing the revenue for the establishment, and the patient is faced with an ER admission because of their blood pressure readings. The bottom line is that education is key to the awareness and accountability of our patients. What we do in the hospital trickles out into the community. Healthy People 2020. You will hear about the Healthy People 2020 initiative multiple times throughout our coursework this semester. Healthy People was designed to reduce chronic illness such as diabetes, renal failure, and heart disease by reducing disparities in healthcare services to ethnic, racial, and vulnerable groups. And it provides access to preventative care. Some examples of Healthy People initiatives are providing mammograms at no cost to women, thus early detection, which decreases healthcare costs and promotes longevity. Another example is providing breast pumps to new moms. Her children get the benefits of the breast milk from the mom, reducing healthcare costs for the child, and providing adequate nutrition. The Healthy People 2020 goals are listed. These are important to know and understand, and you may see them again in the future. Number 1 is attain high quality, longer lives free of preventable disease, disability, injury, and premature death. 2, achieve health equity, eliminate disparities, and improve the health of all groups. 3, create social and physical environments and promote good health for all. And lastly, number 4, promote quality of life, health development, and healthy behaviors across all life stages. Let's shift our focus to public health nursing. Public health is described as what society collectively does to ensure that conditions exist in which people can be healthy. Public health nursing is a growing field due to an increased demand for nurses in outpatient, ambulatory, and home care settings. Patients today are experiencing shorter hospital stays, which can lend itself to the growing need for community-based care. Please view the 2 YouTube videos. The second video on community health encompasses many aspects of what we will be discussing throughout our course. Public health continued. There are several principles of public health. Please read over these and understand them. The principles are as follows: a focus on the aggregate, promote prevention, encourage community organization, practice the ethical theory of the greater good, model leadership in health, and the use of epidemiologic knowledge and methods. Public health nursing is a synthesis of nursing and public health within the context of preventing disease and disability, promoting and protecting the health of the entire community. The 8 domains of public health nursing practice are as follows. Please know and understand these domains. They are important concepts in the management of community health. Number 1, it is important to have analytic assessment skills. 2, policy development and program planning skills. 3, communication skills are needed. 4, cultural competency skills. 5, community dimensions of practice skills. 6, basic public health science skills. 7, financial planning and management skills. We'll talk a little bit about that later in the semester. And 8, leadership and systems thinking skills. What can public health nursing do for your community? They can prevent epidemics and spread of disease, protect against environmental hazards, prevent injuries in the workplace, promote and encourage healthy behaviors throughout the community, respond to disasters and assist communities in recovery, and assure the quality and accessibility of healthcare services. Let's shift our discussion to the milestones in public health and public health nursing. The dates provide an overview of the key milestones in public health nursing and the contributions made, ultimately advancing healthcare. In 1789, the first local health department was established in the U.S. Some key figures in the movement toward public health were Dorothea Dix and Florence Nightingale, which should come as no surprise. Dorothea Dix was a political activist who brought awareness to the conditions those in mental hospitals and prisons were enduring. The Shattuck Report was influential for the time because it reported health and illness traced to unsanitary conditions. It was the first report to include both birth and death records, along with demographic data to describe the health of a population. The Shattuck Report provided the foundation of the sanitation movement. A few years later, Florence Nightingale started to focus on infection prevention and improving environmental conditions. Facts and important historical figures in public health movement continued. Clara Barton established what we know today as the Red Cross in 1882, providing neutral aid in times of war and disaster. In 1893, Lillian Wald established the Henry Street Settlement in New York City, which later became the Visiting Nurses Association. Wald is considered the founder of public health nursing. She is credited for teaching hygiene to immigrant women and the importance of preventative care. She appointed the first professor of nursing, laying the foundation for nursing education. For examination purposes, you will need to know the key historical figures and their accomplishments. You will not be asked dates. Challenges still exist in the 21st century for public health nurses. Engaging in evidence-based practice is important because nurses need to use the best evidence available in making decisions with clients about their care. Helping eliminate health disparities in underserved populations continues to be a struggle. Nurses in public health and nursing in general need to demonstrate cultural competence due to our growing diverse population. Cultural competence is the understanding of what characteristics make up the cultural group. How can you as a future nurse become more culturally competent? Here are a few easy steps. Respect differences that you may have with the client. Understand your own beliefs. Do not let your own personal beliefs influence others. This is known as the concept of ethnocentrism. Lastly, respect decisions made by the patient. Other challenges are planning for community change, creating safe and healthy environments, emergency and disaster response planning, and responding to global changes in the environment. Now we will move on to the topic of community assessment. This information will provide the framework for your community assessment project and will build a better understanding of why it is necessary to assess the community, as well as define key concepts related to the topic. Defining a community. A community is derived of a group of people sharing common interests, needs, resources, and the environment. An interrelating and interacting group of people with shared needs and interests. Some examples of a community are this class, Kent State University, a hospital unit can be a community, and what we recognize most is a city or a town. Types of communities and key community terms. Please refer to the graph on the next slide, as I will make reference to it. When you start to work on your community assessment project, you will want to define the community and its boundaries. The geopolitical community, located in the lower left of the slide, is categorized as a community or persons living in a specific area, which possesses geographical boundaries and shares the same governing structure. Think of the geopolitical community as a county, such as Summit or Stark County. Aggregates. Who or what are they? Aggregates live within the boundary of an area, or aggregates can come in and out of the community. Notice how the arrow in the graph goes both ways? Because they work or go to school there, and they do not live in that area. I would be considered an aggregate to this area because I live in Summit County, yet I go to work in Stark County. Phenomenological communities are members of a community with common interests, beliefs, and goals. Within the community, the group decides what activities or outcomes are meaningful to them. A phenomenological community can exist within the geopolitical community, and their borders are less defined. Some examples of a phenomenological community are the homeless, women living with HIV, religious groups, academic groups, and social groups. Communities of solution are not composed of persons or aggregates from the area of need, but include persons from surrounding communities who have a vested interest in a change for that community. Think of the Flint, Michigan water crisis. There were communities of solution that formed to come to the aid of those living in Flint who had no safe drinking water. Community assessment. The community assessment is a critical process for the future because the process may identify a method to improve the health of at-risk clients. A community assessment includes examination of biological, psychological, and sociocultural influences of the environment that surrounds a specific group of people. Chapter 11 of your Harkness and DeMarco text will be a good resource for your community assessment project. The assessment is a comprehensive evaluation of the overall status of a community. The community assessment will assist in identifying vulnerable populations as well as underserved populations. Underserved populations may include women, infants, and children, ethnic and racial groups, and those at a socioeconomic disadvantage. Clients who live in rural areas or who are incarcerated are a portion of the population that is underserved. The assessment will identify unmet needs, such as a lack of healthcare resources or minimal recreational areas. It will also identify what resources are available, such as hospitals, libraries, grocery stores, and parks. There are common elements of assessment and planning frameworks. Most assessment and planning frameworks include steps or phases that reflect the following actions, some of which may occur simultaneously. First, you need to organize and plan. Second, engage the community. Third, develop a goal or vision. 4, conduct the community health assessment. 5, prioritize health issues found through the assessment. 6, develop a community health improvement plan. This is also the teaching plan. 7, implement and monitor community health improvement plan. And lastly, you want to evaluate the process and the outcomes. Frameworks for community assessment. Frameworks provide direction for the assessment. The epidemiologic approach is a means of studying health-related trends in populations for the purpose of disease prevention and assessing the community through gathered information and statistics. Once this is complete, the health and well-being of the community is evaluated and healthcare needs are addressed. The community as a partner framework are those living within the community and the aspects in which they are continuously interacting, such as the physical environment, economy, transportation, education, and government. Gordon's functional health patterns utilizes assessment as a form of evaluating and assessing behaviors that occur sequentially across time. Understanding the patterns provides insight into problems and actions taken to solve the problem. The functional health status approach evaluates health patterns in the community. Developmental models and approaches are utilized to describe cultural change within the community or aggregate over time. This model highlights the variables that may have contributed or hindered changes in the community. This is a historical approach to assessment. The asset-based approach identifies community resources and strengths along with community needs. The collaborative model involves assessment by an interdisciplinary team and members of the community. The approach used depends on the type of community that is to be assessed. Combinations of frameworks can often be used. So you may be asking yourself, what's the next step? First, you need to identify a community in which the assessment will be performed. Then you'll go out in the community and perform a windshield survey. You want to interview key informants. You want to access resources for information. We'll talk more on the next slide about that. From there, you'll develop a nursing diagnosis for your community. You'll implement a plan of teaching, and then you'll evaluate outcomes. Were they effective? Ways to collect data for a community assessment. The internet will be a beneficial tool for your community project. Here, you will be able to review and assess community statistics. Throughout your assessment, you are expected to interview people living in the community. People who live or work in the community are known as key informants. They can be nurses, doctors, teachers, clergy, or even someone working at the grocery store. A windshield survey is literally driving, walking, or biking around the community and making observations. What exactly is it that you are taking into account during the windshield survey? You're assessing the noise, traffic patterns, road conditions, availability of sidewalks, schools, libraries, recreational areas, hospitals, and fire and police. Other means of collecting data are through community guides, research publications, newspapers, surveys, and libraries. Please refer to box 11.3 on page 195 of your textbook. There are multiple resources available for community assessment. You may also want to check out the Blackboard course for additional resources. Now it's time to go out and start planning your group community assessment project. Good luck!